me now. That's exactly what it says. Isn't your name Jack Sparrow? That's weird. Okay. But if you cannot remember what is your exact appointment, I will have to do a general examination. Yes, a preliminary exam before you can go ahead and have a consultation with a specific doctor. Yeah. That's kind of like my job, yeah. Okay. Is it your first time at our clinic? Interesting. We will have lots of fun, I promise you. Alright. If you could please tell me your full name, I will try and find you here on the list. Also your date of birth, because sometimes names can be pretty common and, you know, mistakes happen. Okay. Good. Found you. So you do have a general checkup, but it says here that you also want some measuring. What exactly would you like me to measure? Because that's not something that I usually do, but I am open to anything. Okay. Oh, intriguing. Yeah, of course we can do that. I have seen everything at this point, trust me. I have seen somebody, it was last week, and they came in like, you know, like everything was swollen and red, and it looked like it's going to just fall off, you know, but people panic, you know, I've seen worse. I mean, it is kind of like treatable, not really, but you can treat the symptoms. This is why I always say protection is very important. Very important, yes. Okay. I'm sure though that everything is okay with you. Yeah. Alright, so let me start by measuring your body temperature. Okay, lift your arm please and squeeze as tightly as you can. You know, with everything happening in the world, I need to, you know, be safe, so if your body temperature will prove to be abnormal, I'll need to wear a mask. Or just kick you out, you know. Alright, it seems like your body temperature is normal. Like you, I don't have to kick you out. Now let's quickly listen to your lungs a little bit. Do you smoke? Anything? Okay. How often? Okay, not a problem. perfect, yes or no? Perfect. Can you see the light? Okay, what about now? What about now? What about now? Can you see the light? Can you see the light? What about now? What about now? What about now? Can you see the light? Good. Perfect. Now could you please look straight into my eyes? And I am sorry if this will be really bright, but I want to take a look in your eyes, in your beautiful eyes. You have such a beautiful, unique color. Did you know that? Okay, I want to take a quick look. Perfect. Good. Now could you please look at my nose? Great. Perfect. Now look up for me. Look up. Now could you please look at my finger? Yes. Just at my finger and ignore the light. Now, am I moving the finger? Now look at the light and ignore the finger. Great, same thing. Great. Now could you please just look at the tip of the finger? Look at the tip. Look at the tip of the finger and ignore the light. Great. Can you see the light now? Can you see it now? Can you see it now? Good. Could you please let me know when can you start seeing any movement from my hand? Good. Good. Alright. Can you see it now? What about now? What about now? What about now? And now? Good. Now, could you please follow the light for me? Excellent. Okay, perfect. I got stop staring at your eyes. I'm so sorry. I know that this is completely unprofessional, but I am really, really honest. Yeah. I mean, I've never been officially diagnosed with autism, but everybody tells me that my honesty can be brutal sometimes. I mean, so far so good. My patients did not complain. Alright. Good. 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 Perfect. I will ask you to take a look at the the light clearly? Okay, how many fingers can you see? Good. Is it blurry? Okay, how many fingers now? Good. What about this one? Can you see the light? Can you see the light through the lens? Okay, can you see my finger? Clearly. What about now? Is it blurry or is it clear? How many fingers? 1, 2. 1, 2, 3. How many? Okay, what about this lens? Can you see the light? And what about now? Can you see the light? How many fingers can you see? Is it blurry at all? How many fingers? 1, 2, 3, or 5? Okay. Could you please expose your elbows for me? Oh my goodness, you are one muscular human being. Okay. Does that hurt? Okay, great. And now the other one. Is this painful? Alright, great. And now your knees. Try and keep your legs as still as possible, okay? I don't need any additional bruises. I am clumsy enough myself, so yeah. Okay. Okay, very good reflexes. Is it painful? Okay, the other knee. Perfect. Great. I would like to take a look at your beautiful face. Alright, do you mind? I'm sorry, I'm just talking to myself. Just taking mental notes. Very symmetrical and beautiful face. Really healthy. If I apply some butter here, it doesn't hurt. Okay. Now close your eyes for me, please. Close. What do you mean? No, I definitely did not try to kiss you because that would be really inappropriate. Yeah, like real bad. No. That was part of the exam, definitely. Okay. Let's get over that moment. Okay. Alright. Now, for the measuring, may I ask why do you need these measurements and your health examination together? In like those kind of movies. Really interesting. I've never met, an actor like you before, but I mean, that is really, really, really intriguing. No wonder you look like you look like, I mean, yeah. Yeah, let's concentrate. I'm talking to myself, not to you. You seem quite concentrated, but I mean, not to brag or anything, but I mean, you kind of like were lucky and you got like the best nurse in this entire hospital. Yeah. I'm like super qualified. What's my experience? Well, if you take into consideration my experience with animals as well, I mean especially cats, like over 15 years, if you take into account only my work with humans, you know, around 5, but really long. Leg, really long. And the other one. Beautiful. Now, just to keep the same position because I will measure your pelvis. Yeah. You definitely don't skip leg day. And that can be a sensitive area, but I'm a trained professional, so if you would be just relax for me, so we could get an accurate measurement, you know, of that. Yes, I've changed my mind. You are perfect. promise, and that you will come back